Hey, welcome to your local fast food chain. Can I take your order?
Yeah, can I get a double cheeseburger, large fries, some tots, and I guess a diet soda?
Hi, everyone. Thank you so much for joining us today. I'm Jess.
And I'm Sav. Welcome back to And a Diet Soda, episode 24, Culinary Medicine from a Physician. Hi, it's Sav and Jess. Welcome to And a Diet Soda, an opportunity for people to celebrate their successes, share their failures, and hopefully give a little advice on all things relatable along the way.
This community is for appreciating the little things and fostering positive mindsets and intuitive thoughts by talking to people, because chances are they've been through it too.
Yes, this is going to be a super cool episode. I'm really excited to learn about culinary medicine again. If you guys remember, we touched on this topic in a very early episode, I think in the beginning of the podcast back in like April. And we've certainly come a long way since then. And I'm super excited to bring it back full circle as we talk about issues surrounding obesity, health, and diet culture.
So today's guest is Dr. Nisha Patel. She's a culinary medicine and obesity physician. She always shares evidence-based research on healthy eating, living, different foods. You have to check out her social media. You can always learn something from her. But with a family history of diabetes, Dr. Patel has a personal connection to this area of medicine. She's a lifelong vegetarian, has gone through her own personal journey with finding things that are quick and healthy. She also knows that eating healthy doesn't always mean being on a diet, and she's able to show people how to enjoy eating healthy and finding those sustainable foods. So Dr. Patel is an educator, works with patients and colleagues alike, and we are so excited to talk to you today about nutrition in the medical community. So thanks so much for being here with us.
Thank you both so much for having me. This is honestly my favorite topic to talk about, and I could talk for hours, but we won't do that to all of you today. But thank you so much.
It's so easy to get like going on this topic. So yeah, we'll definitely try to rein it in, but it's I feel like everyone can gain something from this topic. So we're just going to dive straight in. So were you always interested in culinary medicine, or was that a passion that you found like later on in your medical training or career? What did that look like for you?
Yeah, that's a great question, and the short answer to that is no, actually. So, through all of my medical training, that includes medical school and residency, physicians across the world, across the nation, are just not taught about practical nutrition education. And we go through so much training, so many nights studying, and so much information that we're expected to absorb in such a small amount of time that this just doesn't get emphasized. And when it does, it's really just like scant. I mean, it's just a couple of lectures in your preclinical years, not even when you're out seeing patients, and really dedicated to talking about, conditions that are important for you to know as a physician: nutritional deficiency syndromes, how to treat certain conditions of errors of metabolism. And so, when you think about that, even though that's important to know, that's not going to help me as a physician teach somebody, okay, I know you want to start eating healthy today, but let's start making these practical changes now that make sense to you, that are within the confines of your culture and your society and your budget and your life. And so that's the piece of information that was really missing. But, I didn't realize it was missing. I didn't realize it was missing until, years after I was done with training and I was already out in clinical practice as an attending physician. And I started noting some of my own concerning changes in my lab work. As you mentioned, that I do have a really strong family history of diabetes and heart disease, and I'm South Asian. And for any of the listeners out there that may not appreciate why this is so important, is that South Asians tend to develop diabetes at a younger age. They develop diabetes along with cardiovascular disease at a younger age. And we tend to have more severe consequences of both of these disease processes. In fact, India is the diabetes capital of the world. And so there's clearly something in our genetics that is still being explored. I can't really point to one gene and tell you that's the issue. It's definitely not that simple. But I started seeing those changes, and I was young. I just turned 30, and so I knew that if I didn't start making changes to my lifestyle, that this was going to catch up to me, and this was it was going to catch up to me sooner than later. And I was just so confused as a physician, so confused on how to even start doing this. And so, you know, through my own reading and just learning more about practical nutrition education, that's where I discovered culinary medicine, and it's really changed my life and how I talk to my patients, talk to my family, how I think about nutrition. There's no going back, but that didn't come until after training. And I wish I had known about it sooner. I wish I had known it sooner, but it's okay. Here I am.
Yeah, no, thank you so much for sharing that with us. I have a question for you as far as what treating patients looks like now that you do know, and you've gained all of this education and you do have that personal connection. I know that it's really important to kind of meet people where they're at, and when they're able to like start to be ready to make subtle changes in their diets and lifestyles. What does that typically look like? I think when we spoke before, you said that you work in outpatient setting.
I'm actually currently in an inpatient setting. So I see a lot of patients that are admitted to the hospital with exacerbations of their underlying medical conditions. So I see patients with heart disease and non-alcoholic fatty liver disease leading to end-stage liver failure and diabetes complications. I mean, a lot of the disease processes that I treat, you know, there's definitely a lifestyle component as far as risk factors are concerned. And so I didn't even realize like how interested patients are to talk about food until I was actually was more aware of it, I should say, because, you know, in the past, for instance, when I was on my medicine wards in residency, you know, I was discharging patients that had just had a heart attack, and we would go over their medications, but not once did I talk to them about their lifestyle or their nutrition. And now it's all I can talk about. And patients are genuinely, more often than not, so interested in A, the fact that their physician is talking to them about nutrition, and B, they want to learn more, they want to hear more. Some patients haven't heard of the word gut microbiome. You know, we're talking about all these things. I see a lot of patients with GI illnesses like gastroparesis and inflammatory bowel disease, and just taking that time and using all the resources that I have available to me in the hospital. I mean, I have a captive audience. Patients are, you know, if they're not incredibly sick to the point, you know, that they aren't able to have conversations, and a lot of them do want to talk about these things throughout the day. And so I mean, it's counseling that's built into my day-to-day care. When, you know, I hear a lot like, oh, I don't like the hospital food. And so my patients and I, we pull up our menu, and, you know, that's something that's not in my control. That's very hospital based and hospital system based. But we start talking about how can we start building healthful meals even while they're in the hospital, or how can we, you know, I carry the whole grains, like there's like a pamphlet from the Whole Grains Council. I carry it in my pocket, and we're like, and because I mention whole grains to people, and their eyes might gloss over, and they're like, what's a whole grain? And so I take that as an opportunity, a teaching moment, to say, like, look, this is a whole grain. This is why it's beneficial. You see, I'm watching your blood sugars right now. Let's just do a little experiment. I mean, it's not the perfect setting, you know, people are already sick and you want to catch them. You want to try to prevent these illnesses from occurring. But to say that, you know, it's too late, or you're you know, too late to make changes, I don't believe in that. There's very few instances where I would say that, you know, it's just too late. And so I take every opportunity that I get to talk to my patients about their nutrition and their lifestyle. We talk about non-exercise activity thermogenesis, which is basically what you think of as fidgeting. So moving around, doing dishes, you know, like cleaning the car. Who cleans their car? I don't know. But I don't know why that came to my head.
I need to, I tell you what.
Yeah. Cleaning the room, like sleeping, just kind of walking back and forth in place, like when you're on the phone. Those are all beneficial activities that can improve your metabolic health. And so my patients that are able to fidget more than others, like I'm like, let's fidget in your room. I know you're in the hospital, but we got to keep you moving. And did you know that non-exercise activity thermogenesis can actually improve your blood sugar and help with weight management? And again, like a captive audience, a lot of my patients haven't heard of these terms before. And I'm writing on their whiteboard, whole grain, non-exercise activity thermogenesis. let's talk about protein. Let's talk about, have you had tofu before? I mean, it's just all of these things. And I just didn't realize like how important it was. And I didn't realize like all of these small opportunities adding up, it's been great.
Oh,
It keeps me
yeah.
grounded.
Yes, that's so exciting. I mean, all of a sudden, you're giving your patients so much power to change their lifestyle. You're giving it all, and they're like holding it in their hands and looking at it in front of them. And that's probably what's so exciting, is that this is something really tangible that they can change for themselves, that they don't need a doctor to prescribe or keep coming back to get refilled or anything like that, or a surgery. And so I think that's really, really empowering for people. And starting at a young age too, like you mentioned before, how people have never heard of this before. Well, why don't we teach it in schools? Why don't we have education that is in layman's terms for kindergarten, middle school, high school, like all of these different age groups where you need to learn that, yes, the packet of fruit gummies is really good and it's your favorite snack and mom packs it for you, but that's not all that there is, and there are fun ways to teach it. So you're definitely on the right track with that. I mean, come on, like, let's get going here.
Yeah.
But I'm also wondering if it ever just really frustrates you. Like you're talking about all the positive patients right now and how receptive they are and how much they're willing to learn, but I'd imagine that you also have those patients that the answer is right there in front of them. You're giving them all the tools they need to succeed, and they're just not doing it. And they just don't want to. They don't want to make the lifestyle change. I mean, what do you feel when people just refuse that help when it's right there?
Yeah, that is a really great question. And I think the approach should always be to really try to empower our patients. And I think a lot of patients are used to, they go to the doctor with a problem and their doctor gives them a medication, and that's kind of the end of that. And then they come back maybe for a follow-up visit. So I do use a lot of motivational interviewing techniques, trying to get patients to come to the realization on their own that, they need to make a change in their life. Because if I tell them like, hey, you need to start eating whole grains, or you need to like eat 5 more servings of vegetables a day, I mean, that never worked for me. It just didn't. I mean, people told me that all the time. I was a vegetarian and I was telling Stan that I did not like vegetables, and I did not like fruits. So you can imagine what my diet was like. But going back to your original question is, whenever I do run into patients that, that some patients, they put up the wall and they're like, I'm not ready to talk about this. And I understand that, because the setting that I'm in with my patients, it's, they're sick, they don't feel good, they got 10,000 other worries going on. How's my cat being taken care of? How are my children being taken care of? My job is like on my case about. So I understand that scenario. And I know that it's not, it's not personal. They're just not at that point ready to talk about it. And then there's the patients that, you're getting there, they seem like they're ready to talk about it, but they're still a little hesitant. And that's where you really start using motivational interviewing and trying to come up with, trying to help them come to the conclusion that like, look, I can actually make this change, or I want to make this change. Because sometimes we don't know what we don't know. We're scared. We put up our own roadblocks, and it takes time and it takes effort. But it's a process, and it's like Savannah said earlier, it's meeting people where they're at. If, I'm not going to tell somebody that is used to eating, fast food 10 times a week that they have to cut out their fast food, because you're asking them to literally overhaul their entire dietary pattern for that week. But if, we can get them to cut out 1 meal or 2 meals, or we can, reach an agreement, I think that's really great. But it's really about empowering people to come to that realization on their own. And that's still a skill that I'm building and learning. But it definitely has changed the way I practice medicine. I don't, it's a conversation. It's not just telling people what to do whenever, in a lot of clinical scenarios. Now, obviously, if a patient is crashing and they need, when I say crashing, they're very sick, they need care now. I mean, we are going to all hands on deck. We're giving them the care that they need. They may not be able to, participate in that care, but we got to save their life, right? But this is more for the scenarios where the patients are less sick. And I think this definitely translates to the outpatient setting too. I mean, I know that there are a lot of primary care doctors, are out there trying to practice prevention as much as possible. Unfortunately, our healthcare system is not conducive to it. It's not. Our primary care doctors do not have enough time to practice preventative health, and it's horrible. Or there's not enough time, and there's not enough reimbursement for it. And even though that's where the dollars really need to go, it's just, it's I hate to say it, screwed up all around, unfortunately. But yeah,
that
a little
blows
bit of a
my
tangent,
mind.
sorry. Yeah.
No, that was fantastic. It blows my mind that there's not a market for it. Granted, I know little to nothing about insurance or big pharma or anything like that, but the health and nutrition area is so massive and makes so much money as it is away from medicine that really surprises me that the two haven't bridged a gap and made a really popular and profitable, for one, kind of industry. But I have like kind of a small follow-up question to that. It's totally okay if you don't really have an answer for it right now. But I was just wondering if you have anything to say to like anyone out there who's listening, who's not at that crashing point, at that dire hospitalization point, who's looking for a lifestyle change but doesn't really have the motivation for it. What would you say to someone like that who comes into your life?
That was literally my question too, Jess.
Oh my God, fantastic.
Just to add on to her question too, for maybe somebody who, I mean, because you do focus on culinary and obesity medicine, maybe somebody who does have these disorders or diseases such as obesity, diabetes, cardiovascular disease. I mean, it's really a fearful thing to learn about, and people aren't given like any type of resources. They're just told like, you're overweight, you need to lose weight, and then they don't really know what to do from there. So yeah, just what would you tell anyone going through that similar situation?
Yes. So I'm so glad you brought that up. So the first thing I tell people is that you are not your disease. So we as a society and as a medical community need to use people first language. I think especially in the case of the chronic diseases of obesity and overweight, we have labeled people as obese and labeled people as overweight, but that's not how we should view it. I tell people you are not obese. You have obesity, you have diabetes, but those don't define who you are. So I think when you take it out of that context that others have really like kind of forced on them, you put control back into their court. The last thing that somebody that is trying to make changes in their health, the last thing they want to feel like is that they don't have any control, right? I mean, it's so damaging. And I think that mindset, that just wording changes the way that people view their care. And so that's the first thing that I talk about.
I just want to just interject real quick. I'm so sorry because I want you to say everything you want to say. Isn't that funny though, how that's such an English language thing? Like you look at any other language and it's, I have happiness or I have sadness, and that's how it's said. But in English, it's I'm happy, I'm sad, I'm obese. It's just,
yeah,
it's crazy.
No, it is. It's the semantics matter, and like even changing and make, like I'm very mindful like in the medical record, like how I document, because I don't want anyone, and unfortunately I think I'm one of the minority in that documents like this, but again, like I think this is where the education part for my colleagues and for other healthcare practitioners really comes in, is that we really have to start understanding that people are not who they're not defined by their disease. They're just not. Not defined. I have Hashimoto's thyroiditis. I'm not Hashimoto's. So,
right. Yeah. What I think that there's something to be said for that. I mean, what do you think the difference is between it? I don't know how to really formulate this question, because like you just said, like, yeah, somebody wouldn't say like, I am Hashimoto's disease. They wouldn't say that. But anytime it relates to like a physical appearance, it seems to change the language. Like I am obese. It's correct. Yeah, you're correct saying I have obesity, but instead it seems to be like anything that is physically, like you can physically see it, especially when it comes to weight, it turns into the entire identity of the person. Do you have any thoughts on that at all?
Yeah, no, I agree that the chronic disease of obesity is treated so much differently than having like heart disease and diabetes. And that's why there's a whole field of medicine, obesity medicine. This is the reason that it exists. It exists because obesity is a chronic disease. It meets the definition of chronic disease. It has actual pathologic processes that are happening. It's not about, oh, you just ate too much and therefore you developed excessive fat. It's, changes in your brain. It's your environment. It's your genetics. It's it's your immune system. It's so many different factors that play a role in the development of obesity that, just boiling it down to physical appearance is it's not okay. And this is why the field exists. We want to end the stigma, not even reduce it, end the stigma of obesity. We want our providers, we want patients, we want the public, we want people to see obesity as a chronic disease. And, alluding to what you said earlier, that we spend all these dollars on, fighting the fires, one of the places that we need more dollars spent is on therapies that are actually proven to treat obesity. And that includes pharmacologic therapies, because they do have an indication when they're needed. And so, as an obesity medicine board certified physician, I know myself and colleagues who are all advocating on our social media pages within our own within our own communities to expand coverage for treatment. And it's a battle, and it's a battle that's needed, given that what our country, when we look at the health of our population, it's not the greatest. We all know that, and we need all hands on deck to improve it.
Right, absolutely. So I have one more. We're getting like so off our outline that we originally created, but I love it.
Oh, sorry.
So no, this is fantastic. It's Sav and my fault because we just keep thinking of these questions that we want to ask you. So I have one more follow-up to what you just said, and then I want to go back to what Sav and I asked before about what you would tell someone, because I interrupted you because I had another comment.
Oh, it's okay.
So, yes. So I want to ask you, with destroying the stigma of obesity, how does that in your mind relate to body positivity and everything that we have going on in this world, where people are so I don't even know what like the culturally correct term is, but how all body types are appreciated and loved and you're beautiful at every stage. And so how does that relate to what you're trying to do with obesity, both destroying the stigma and curing the disease, because it does come with so many other health problems. No matter how beautiful and confident you are, there are these underlying health problems that go along with it.
Yeah, I think that, a lot of individuals, when they talk about their weight, they focus a lot on a number on the scale. And it's really important to understand that, like, for instance, the BMI gets a really bad rap. And I'm just going to go and say that that's a screening tool. That's not a measure of some hard measure of how healthy or unhealthy you are. There are people that are normal weight that are metabolically unhealthy. There are people that have overweight and obesity that, may not be metabolically unhealthy. But as far as how it relates to body positivity and loving your body, I mean, at the end of the day, we should all love our body, right? We should. And that's okay. You can love your body and still work towards getting healthier. You can love your body and still work on decreasing your risk of developing heart disease and diabetes. It's not either or. So just because, a treatment, for instance, if you want to put your diabetes in remission, you can do that by having modest weight loss. And just because you did that, it doesn't mean that you've shifted to the diet culture mindset. That means you're improving your health. You're improving your longevity. You're improving your life. It's more than just getting down to the size that society dictates on you. It's more than bikini body ready. Like we all cringe, right? So I don't think it's exclusive. You can love your body and you can get healthy, and both of those things go hand in hand.
Yes, beautifully said. Yes, love
I
it.
think it's what we struggle with the most on this podcast, because we do love to speak about intuitive eating, and we love to talk about body positivity and learn about people's experiences about, you know, getting away from diet culture and finding love for themselves. But we struggle as scientists too, and people with these research brains, because we want everybody to love their body and feel healthy and happy. But at the end of the day, if they're also struggling from something that might be metabolically damaging to them, that's scary. And so we don't want to push that message too hard. So it's something like a constant balance. So we just appreciate how you said that, because it's this balance. It's never just one or the other. But with all of that being said, then we'll try to get back to where we came from. So how do you handle the misinformation on social media? Because this is like a whole, I don't even think anybody can handle it. It's like so infuriating, but like, how do you take it into your own control on your own page to like try to spread what's real through evidence-based research and medicine?
Yeah, the misinformation on social media across different platforms, across different topics is just, it's unreal, you know? And I think a lot of people or patients that turn to certain accounts, or they turn to the misinformation for answers per se, is because at some point maybe in their lives they've been, and I quote, wronged by the medical community. And perhaps somebody, and for instance, if it's about weight management, perhaps some physician or practitioner told them to eat less and move more. Or perhaps somebody was dismissive of their health condition or their symptoms. And a lot of, and I unfortunately see this every day on social media, if you scroll through specific accounts that are spreading this information, they're almost invariably using what I just said as ammo to push their agenda forward. And I think the first aspect is recognizing that and taking ownership of the fact that, look, modern medicine isn't perfect. You know, I don't go and attack people. I don't go and sit there and call people out or use profane language on social media. But, you know, if I see something that's damaging, I used to in the beginning, when you're getting used to social media, you're like, oh, what is this place? It's kind of scary. But now, you know, I politely comment and I say that this is not founded in science, or can you please provide me the evidence? And I will tell you, a lot of those accounts, it's like crickets. I never get the evidence. I'd say DM me. I would love to see the evidence or the science, or where did you get this information from? And nobody ever provides me with anything. I use my platform to really combat misinformation. If I see a claim, like yesterday I posted about the thyroid diet. I see a lot of claims about the thyroid diet and this optimal diet of being, you know, gluten-free, dairy-free, X amount, stop this, stop that. And I'm like, there's no like strong evidence behind this. If it works for somebody and they feel better doing it, am I going to discourage it? No. But am I going to go and use it as a dogma and tell people that this is what they have to do to feel better from Hashimoto's thyroiditis? No. And so I do a lot of my posts are dedicated in a way to be educational, because that's the whole point of me creating Dr. Patel, and factual, but also combating misinformation. Today I posted about how, you know, I'm sure everyone's heard, oh, calories in equals calories out, but then everybody forgets about the complex metabolic processes and behavioral processes and neural processes that go into appetite and energy regulation. And so I want to empower people with information so that when they see the claims on social media, that they can think for themselves, right? And they don't just, and I tell people, don't blindly follow anyone, including me. Like, you got to have critical thinking. But there's just so much out there, and there's so many accounts that are spreading this information compared to accounts that are combating it. I mean, it's exhausting, and but we're going to keep doing it.
Yeah, I mean,
in a professional way.
Person, yeah. Right? If you can help one person in any way, I mean, it's totally worth it. I loved the post about energy regulation; that was amazing. And I also just love every time I come across like just your name on Instagram and I see like Dr. Plantel, I just like love it. I love the name so much. But I want to bounce off that and just talk a little bit about culinary medicine, because I know you are so passionate about it. So could you first just kind of like give a quick definition of what that even is for people who don't know what it is, and then like how you can utilize it, how somebody who might not necessarily have access to a culinary medicine physician can like research it and like get help and whatever that they might need and direction in their life.
I'm so excited for this. I'm ready. I'm buckled in. I'm ready.
Like, let's do it. So culinary medicine is a field of medicine that combines like the science of health and nutrition and like evidence-based medical science with the culinary arts or culinary skills. And it's exactly that. I made a reel about this. It's me, Dr. Patel, with my chef's hat on too, right? I'm not a professional chef. I don't have professional chef training. I didn't really cook until about 3 to 4 years ago. So let's be real. But you know, it's basically empowering patients with the practical tools to make healthful eating habits in their lives. Like if you tell somebody to go eat more fruits and vegetables, but you don't give them the tools and the skills and the knowledge that's needed, like, hey, why don't you try the specific goal? Why don't you try roasting broccoli in the oven after you toss it with a little extra virgin olive oil and some garlic and smoked paprika? That's like my always go-to example. But if you
don't mind if I do.
I know. If you don't teach people how to find ways to enjoy healthful foods that make sense to them, they're not going to go, like the majority of people are not going to go and eat raw fruits and vegetables, or they're not going to know how to even cook a whole grain, right? Like I gave a lecture to my colleagues a couple of weeks ago, and like it was my top 10 tips of like, you know, starting to make changes today. And I talked about whole grains. We talked about ways to cook whole grains. We talked about ways to flavor whole grains. We talked about how to enjoy them, how to batch cook them, how to cross-utilize them. Those are all skills that are needed so that you can translate that into change. Yeah. And so that's essentially, like in a nutshell, what culinary medicine is. It's using the beautiful flavors of food out there in ways that we already know about, but in practical ways that make sense for you, to create these tasty, healthful meals. Because healthful food can be tasty. You have to be able to enjoy healthful food, or the foods that you eat. If you don't enjoy them and you sit there and force yourself to eat them, which I have, like in the past, you know, I've gone through my own, I've tried to eat healthier in my 20s, but you know, eating raw broccoli and carrots, like for my snack without knowing what to do with them to make them tasty for me it wasn't enjoyable. I would totally bounce the other way. I did it for like 2 days. But now it's like, I vegetarian, Nisha, that grew up vegetarian, love fruit and vegetables. I eat them all the time. I mean, I am primarily plant-based. For personal reasons, I don't eat as much dairy, and I don't eat eggs, but that's a whole different conversation. Those are my personal reasons. But I don't ever expect any of my patients to be that way. And second of all, I just want to help them incorporate more healthful foods. And when you look at the science of what is a helpful diet, or what healthful diets are out there, they all have these commonalities where they include things like legumes, fruits, vegetables, nuts, seed, healthful fats. If you're somebody that eats dairy, it's low-fat dairy. If you're somebody that eats animal products, it's lean meats. But those are all, you know, kind of sparse as far as what forms the base of the foods is plant foods. And so that's what I really focus on for my patients. So you got to learn how to make it tasty. Some people don't even know, you know, they don't know how to cook. They've never been in the kitchen. They've never handled a chef's knife. They may not know how to efficiently cut. For instance, I have taught myself how to use a chef's knife. I can cut vegetables very quickly. I teach other people how to do the same. All those things matter. You need all those skills. And that's what culinary medicine is all about. And I love it. And I wish I had gone to professional chef school before I became a doctor, but that's okay. There are actual MDs out there. There's a handful that are professional chefs. And I'm always like, oh, I must learn from you. No, it's great. It's so great. Like I do culinary medicine classes through, so my culinary medicine certification, like coursework is through Health Meets Food. I'm in the process of completing it and will sit for the exam once I'm done. But you were asking about resources, like how can we learn more about culinary medicine? So healthmeetsfood.com is a wonderful website. It's where there's a lot of free recipes and handouts on there. I often print like recipes for my patients, and then I'll give it to my patients from Health Meets Food. every year there's a conference called Healthy Kitchens, Healthy Lives, which is like, my favorite conference to go to. It's a partnership between the Harvard School of Public Health and, the Culinary Institute of America. And it's held in February in Napa at the Culinary Institute of America headquarters, one of their headquarters, I should say. And it's basically exactly what, we talked about. It's bringing the science of medicine, nutrition, in bringing in people from different industries, professional chefs. There's nutrition scientists, there's physicians, there's all of these great minds that are in one area. And we're all talking about how are we going to improve the dietary pattern of all, not just one population, but everyone. And
I want to go.
It's great.
I know, right? Same.
It's great. Yes, I know. So I didn't even know. I wish I had known about the conference sooner. Again, I didn't know the conference existed until I started doing a culinary medicine coursework. And I will say Health Meets Food also has a culinary medicine conference. And they had it in person, of course, pre-COVID, but I did attend it virtually this past year, and it was really great too. And so there's a lot more information, resources that are coming out about culinary medicine. There's only one certification board. There are other programs out there, there's the chef, I forgot what it's called. It's through Harvard. It's not the School of Public Health, it's the Spalding Center. They have a culinary coaching program. There's a couple of other universities that have their own culinary medicine program. And this is all for, I should specify, this is all for practitioners that are out of training. Now, I will say medical schools around the country more and more are adopting formal culinary medicine training for their medical students. And I think that's awesome. And I support that 150%. I wish I had that at my medical school. Residency, on the other hand, is a whole different boat. I mean, it's hard. There's a lot to pack in 3 years, but I like to spend a lot of my time. I did a lecture for the residents at my hospital, and I'm hoping to do more with them. And any education, I think a residency is better than nothing, even if it's not something that's formalized. But definitely the medical schools are starting to pick up more formal culinary medicine education. Maybe it's a 2 to 4 week long class. Maybe it's something that's longitudinal through their first and second year. But, depending on the medical school, they have, not all of them, by the way, have them, but it's picking up. But depending on the medical school, the curriculum will look different. So,
cool.
Exciting.
Cool. Yeah, a little brag moment, because I think you can be the one to do this. My grandpa was the I want to say single-handedly, but it wasn't, I'm sure. But he brought business classes into, both my grandpa and my dad are podiatrists, and my grandpa made it a requirement for podiatry schools to have a business class as well. And so it's really important. They didn't before that. And so I think that you can be the one, Dr. Nisha, to bring in and make it mandatory for medical schools to have a culinary class.
Totally. I will call on all my culinary medicine colleagues, and we will have to band together and be like, look, this is what we need to do. I know it's definitely, we're in all of us in our own communities, we're advocating and teaching and educating and talking to anyone that'll listen to us about it. And there's still skepticism, right, in medicine about, people look at me and they're like, well, why do you care so much about that? And I'm like, why don't you care so much about that? And it's starting to pick up because we all eat, right? And we all want to be healthy, and we all want to do it in a way that's enjoyable and sustainable. I don't think that people inherently want to follow restrictive patterns of eating for the rest of their lives because this is what somebody told them to do to, lose weight or whatever, get healthy. I think the changes that I make, I'm going to carry them with me through my entire life. But it's a constant work. I haven't reached I'm not the North Star. I'm still working towards it, right? We're all working towards it. I don't for instance, people are you're weird, you don't like avocado. And I'm like, okay, fine. I don't like avocado in the slices or whole, but if you make a sauce out of it, or if it's in guacamole, then I like avocado. Right. So I found a way to eat avocado that I like. So why, how everyone can find, I think almost everyone can find a way to eat healthful foods in the way that they like. Maybe they don't eat, the whole variety, but we can at least find things that they like and they can work on. And I always say small habits add big, small changes add big. And if you're thinking about, if you're thinking about taking that first step and making the change, let's start small. And I mean, we can start really small, right? We can start with half an apple at lunchtime. I'm serious. I know it seems like a small change. Maybe it's half a little serving of berries, or maybe it's, adding 2 sprigs of asparagus. I don't know if they're actually called sprigs, but 2 things of asparagus with your lunch. I mean, whatever it is, like, you start forming small habits and you keep working on it, and until it just becomes second nature. And, motivation, everyone's always saying that motivation is like the most important driving factor, and it definitely plays a role, but making it accessible and easy and habitual for you is super important. And so it's so important. Like, it's like, so for instance, when I was like making changes, like in the morning, I would kind of, like, I knew when I'm drinking my coffee, like I'd have like some blueberries set out, it was like my habitual, like I'm drinking coffee and then I'm eating my blueberries. And that was my way to get some like blueberries in that day without even thinking about it, without even having to plan it. It was just kind of like habitual for me, or I don't know. It just,
you're like clicker training yourself.
I know, I'm like clicker training myself a little. Yeah, that doesn't mean that every single day is like perfect. It's not. We all have our days where maybe things don't go right work-wise or school-wise or whatnot. You just do your best, right? Like, that's all you can do, because your entire dietary pattern over your lifetime matters more than just what you did in one day.
Yeah, and
so important.
I feel like our taste buds really do change too. I mean, I grew up eating like the typical American diet, 100% meat, starch, dairy, everything. Like, everything was crazy. I was like addicted to sugar. It took me a really long time to get to where I am now, and to crave fruits and to crave vegetables.
Crave goji berries.
Crave, yeah, which is still pretty sweet actually. But my question for you is, I wanted to go back to when you said, when we were talking about nutrition and medicine and whatnot. So to me, it's always so crazy that this is not a part of medicine, and it's so refreshing to find physicians like you because you care so much about it. But to me, it's just like, nutrition is medicine, it is health. But how much, I mean, coming from like the scientific evidence-based research perspective, is nutrition that effective towards like your genetics and your health? Like, I mean, obviously if we eat healthy and we exercise, it's going to allow us to live a longer, healthier life. But I mean, to what like percentage or statistic, I don't know, is there people who it doesn't really make a difference? Is that a thing, or is nutrition actually that important to our health and longevity?
That is a really great question. And so I don't have a number, and I never guarantee anything for anyone, including myself, right? I can do all the quote unquote right things. I can exercise. I can try to get 7 to 8 hours of sleep. I can eat as healthfully as I possibly can. Does that mean that I'll never get diabetes down the line? No. Does that mean that I won't get heart disease down the line? No. Does that mean I won't get cancer down the line? No. But you best believe that I'm doing everything I can to decrease my risk. And God forbid were that to happen to me, at least I can say that, I did my best. And and I hate to say it, but this is the way it is. So no, I mean, I guess my answer is, will this 150% prevent you from developing chronic diseases? No. We know there are a lot of other factors at play. We want to make sure that people aren't smoking tobacco, right? Like, that's also really important, or excessive alcohol consumption. There's concern about our environment influencing us. And so it's you can only control what you can control, but you have to try. And that's how I see it. I don't have a percentage of the number of individuals. Everyone's different. Everyone's genetics are different, and genetics do play a role. The genetics are not destiny. They're not, just because your genetics ascribe to something, or let's say you have that strong family history of diabetes. Like, I tell myself every time that not every time, but I tell myself often that, my genetics are not my destiny. I'm doing everything I can to control what I can. and I'm doing my best. And if that means maybe I delay my diabetes by a decade, great. Maybe I'll be really old by then, you know, like, so I don't, yeah, but I want to live as healthfully as I possibly can. I think that's where people run into issues when they put a lot, you know, I see this a lot also with misinformation on social media that is like, take my natural or do my natural program or do my natural supplements, and like, you know, modern medicine is evil. And it's like, I try to really emphasize that I will always advocate for a helpful lifestyle and nutrition. But please, please, please understand that is never in the place of appropriate medical care, because we have appropriate medical care that can increase your longevity. These are all things that work together. We want you to lead the healthiest life possible, but it's just that we don't emphasize nutrition and lifestyle because that's just not been emphasized in our training and our culture, but that's got to change. All of the medical organizations that might be watching this, that's got to change. But, you know, can your lifestyle like influence your actual genetic code? No. However, your lifestyle can influence what's called epigenetics, and that's the
so happy you're talking about
on
this.
And off of genes. We know that genes, you know, are DNA. That's what we're born with. But then there's actual factors that turn it on and off, and so that's where lifestyle and nutrition, all of that plays a role. It, you know, foods that are healthful, they're antioxidants. They help repair DNA damage. And these are not all like, you know, one nutrient or one phytochemical. All of this stuff works together. Your lifestyle works all together to do all of these things. And that's why I don't like when people get fixated on like, oh, I need to eat this specific food because somebody told me that it decreases my risk of, you know, X, Y, and Z cancer. These are all things that work together, and there is a lot that you can control. And I don't want people to forget that.
Yes. Yes. I was
yeah.
wondering, can you please, because epigenetics is fascinating, one, but also very, very complicated. And as a student, it took me a really long time to wrap my head around what epigenetics meant. For me, it was like a little bit mystical because it's, like you said, it's turning on and off genes, it's outside environments. And so as a like repro phys, where my background is, I remember learning about, I think there was a specific case study about people who rode public transportation a lot more often than people who didn't, and how it affected their reproductive status or their children's reproductive status. And so, like you said, there's so many different factors. It would be the same for smokers, the same for if you drank excessive amounts of alcohol. So I was just hoping you could give some like really tangible, specific examples to maybe help our guests pinpoint what epigenetics is a little bit more.
Yeah. So like, for instance, and I'm just going to say, like, I say this without any judgment. When we look at the field of obesity medicine, we look at how maternal factors can affect fetal factors, for instance, or fetal genetics. And there's a lot of research that looks at the maternal environment when the mother is pregnant, what they're eating, what their lifestyle is like, and then they look and see how that influences the turning on and off of genes of their child. And so there's, you know, I think that's like the one specific example that comes to mind. I'm not a geneticist, I'm not an epigenetics expert, but, you know, I think what my point in saying this is that all of these, these influences, our lifestyle, our environment, they do affect the way our genes are turned on and off. And by, you know, following as healthful of a lifestyle as possible, you know, you're hopefully decreasing your risk of developing chronic disease through a modality of mechanisms, not just one. And so I think that's what the emphasis, that's what I try to emphasize to my patients and family and myself and my husband whenever he comes and asks me questions, is that, you know, because I get this question a lot, like, will doing X make me healthy? And I'm like, not ecstasy, y'all. I'm not talking about that. I'm talking about X, Y, and Z. Like, well, I should totally preface that. Will eating X, Y, and Z make me healthy? And I'm like, why, you know, it's like, it's healthy and the totality of everything that you're doing. You need to do all of these things, right? It's not it's not just like if I eat broccoli sprouts, I'm going to be automatically healthy. It's I eat broccoli sprouts along with, you know, an abundance of other fruits and vegetables and healthful foods. And I'm also trying to optimize my sleep. It's not something that I'm working on, and my physical activity and my resistance training and not smoking and not, you know, drinking excessively. And so all of those things play a role.
Thank you. I'm so glad you spoke to epigenetics. It's one of my favorite things that I've learned in my master's degree. I mean, I took a nutrigenomics class and was just blown away. I mean, it's what really like got me interested in this. So thank you for that.
Cool.
It is.
Yeah.
It's so cool. It's like it gives you hope. It's the one thing that it's like how you've said that your genetics are not your destiny. That is why your genetics do not necessarily have to be your destiny, is because of epigenetics, because of how you live your lifestyle. So thank you. It's amazing. But what you were saying at the end leads perfectly into our question of accessibility when it comes to nutrition and food. So everything we've been talking about in this episode, it seems like a lot. I mean, it can be a lot to try to focus on nutrition and sleep and trying to also just enjoy your life a little bit. But I also know that you're very aware of different socioeconomic statuses and what, like things like food deserts, food insecurity. So we've talked a little bit about this. It's one of my favorite concepts because we can preach health all we want, but that looks different for every single person, especially when it comes to their background and what they have access to. So I'm sure that you probably see a wide range of socioeconomic statuses in patients that you treat. And for people that listen to this, they also a huge different wide range of backgrounds, maybe for people who are even on things like SNAP budgets or people who need to use, what is that called? Like WIC, not like WIC. I don't know.
Stamps?
Oh yeah,
food stamps. Sorry, my brain.
Yeah, exactly. Yeah.
Gone. Okay, people who need to use food stamps. But what tips do you have for people who don't have access to just walk in and buy all these vegetables and just like try it out and throw it away if they don't like it or don't have the money or access to get these things?
Yeah, that is such a great point. So I do think a lot about the cost of food, and I do think about, you know, individuals that are not able to consistently afford food, that they're food insecure. And it's a very real problem in our country. Pre-pandemic, you know, it was approximately 10% of individuals were food insecure. I think the number was a little bit higher, but that number has increased since the pandemic has unfortunately been going on continuously. And I don't have any recent data. I think that's still something that's evolving, but we know that, you know, food insecurity is increasing, and the need, you know, from food pantries or food banks has also exponentially increased. And so I think a lot about the cost of food. I read a lot about SNAP, which is actually it's a federally funded, but operated at a state level program that addresses food insecurity by providing individuals that meet or a certain income requirement, I should say, or like their income has to be within a certain percentile as far as the poverty range, and they're able to access funds to buy food every month. It's not enough. Biden actually just increased or just proposed or mandated an increase in the SNAP benefits, but each state has their own requirements, and each state has their own set of amount of money, I should say, that they offer based on your household size. And so it's the largest program that's addressing food insecurity, along with women, infants, and children, and the school lunch program. But all of these it's still not enough. And we know that. And so that's where, you know, food banks and charitable contributions and organizations that are addressing food insecurity locally in the community are really filling the gap. It's a problem because individuals that are, you know, have lower socioeconomic class are also the most at risk and vulnerable individuals for developing lifestyle and diet-related chronic disease. We know that. We see that. I have to meet my patients where they're at. This is why I get very frustrated, especially on social media, when I see people arguing over organic versus non-organic foods, or canned versus non-canned foods, or, you know, frozen, whatever. I get super annoyed because I think they're just missing the point. The people that need help can't always afford fruits and vegetables. They're expensive. Let's be real. You know, depending on where you're buying it from, they can really add up. And if you're on a budget and this is all the money that you have, and we're talking, it's like $4 a day per person. That's just one number. I was looking at CalFresh, $4 a day per person to make all 3 of your meals. I mean, that's really just not a lot of money. And so that's where I really emphasize that, like there's no guilt. There's no guilt in eating canned legumes and canned fruits and vegetables. But let me show you how to pick the most helpful option for you. There's no guilt in eating. If you eat white, bread made from refined flour, let's just switch over to an affordable bread made from whole wheat. Yes, it's, processed, but look, like you got to meet people where they're at. If you start to talk about, your perfect clean diet. I hate the word clean diet, by the way. Sorry, I'm just going to throw that out there. I don't like that word.
No, we've talked a lot about the clean 15 and dirty 10, and that's just not,
I just have a lot of, don't get me started. It's just, I just think it's such a huge disservice. And, you have to find ways as a physician, as a practitioner, as a healthcare provider, as an individual, you have to find ways to make it easier for people to eat healthfully within the confines of their budget. It's really, really important. And I feel very, very strongly and passionately about this. I don't tell a lot of people this, and I'm not ashamed of it, but I didn't grow up privileged. And, there were times in between when my family, like my parents got laid off or something else happened that, we had to depend on government assistance for our food. So I have been there personally, and I know what that feels like. And so I don't want anyone to ever, like my patients or anyone to ever walk away and think that I have some elitism when it comes to food. It's not. I will do my best to help you eat healthfully and what's available to you. If you look at like the SNAP website, I've been on the SNAP website. I've looked at SNAP Ed. I try to see like what resources they offer for, people that aren't able to meet their food requirements or their food needs, I should say. And there's not a lot of resources out there. They talk, there's information of how to stretch your budget or, how to make, keep foods that are on the shelf that last longer. And a lot of those foods are not fresh fruits and vegetables. Would I love for each and every person in this country to have at least access to fresh fruits and vegetables? That's the first problem, right? We got to teach them what to do with it. That's whole down the line, but access, of course. But it's not the reality. And this is what, I wish I could just like scream at our, our lawmakers, not scream, I wouldn't scream at them, but, I would say like, look, this is where we need to invest our dollars. And education is super important. And then teaching people what to do with that food when they get it is really, really important. And so, I've looked at organizations in my community that address food insecurity. I've tried to learn about them. I actually, was able to meet her name is Dr. Hillary Seligman. She's a physician food insecurity expert, and she's also an advisor to Feeding America. She's professor at UCSF. And so I was able to, talk to her and learn from her. And that was really great because, it's just, we need more physicians thinking about food insecurity. And I screen people for food insecurity in the hospital. We make sure that if there is any benefits that they qualify for, that we can get them signed up, or at least start in the process, or at least have our social worker talk to them about the process, because it's so important. So important.
Yeah, it is. Yeah. And I think that I would love, and I'm sure Sab would love to have another episode. We can call it like Nisha's cookbook or something, play on words, because I would love to hear your process that you tell your patients from prep work to cooking to eating and all that, and shopping, and what different canned foods looks like, what sodium means, looking at a can, and everything. So listeners, that's going to come up. I hope that we can schedule that, because that would be amazing.
That's the practical part. That's what we have to teach people to make the choices and get there. And I do everything that I tell my patients I do myself. I eat canned goods. I have no problem doing that. I just make sure I look for the ones that are less in sodium, and I rinse it off and I eat it. I ate it yesterday.
Right. Cool. So. Yeah. No. And of course, like going along those lines too, like this is kind of a loaded question too, but food labels are everything. And people are so passionate about organic, non-organic, free range, all of these different things that are just another limiting factor for people trying to eat healthy, but they feel like they have to do all these extra things when really it's like, meh.
Yeah, eating healthfully is, the foods that we focus on when we talk about eating healthfully are often not in a package. Yes, like grains and stuff are in a package, and legumes are in a package, or maybe you get them from a bulk bin. It's, there's so many products out there and so many product claims. And like, it's kind of like, my husband probably gets frustrated when he goes to the grocery store because I stop and I look at everything. Like I'm like, oh, that's interesting. So I'll look at the product, I'll look at the claims, and I'll turn it around and I'll look at that. And, he's probably just like, come on, let's go. This is why online shopping is so great, because I can just take my time and like,
I'm the same way.
Learn. Yeah, I'm doing that to learn because I want to know, like, do these product claims on the front really match what's on the back as far as the nutrient density of the food? And gosh, those claims, like, there's just so many, and there's so many buzzwords like low fat, healthy, plant-based. And I'm just going to say plant-based doesn't automatically make something healthy, right? Like, there are, just because it says plant-based on the front, you've really got to still look past it, or gluten-free or non-GMO or whatever. Like, all of those claims, I really think they just throw people off. And it's important to be able to understand the ingredient list. It's important to understand the nutrient facts label and really make a judgment based on those objective measures versus what the manufacturer, who is motivated to sell their product, what they're putting on the front. It's a skill. I come home sometimes thinking, so I've done this, we've all done it. We've all gone to the grocery store and I'm in a hurry. And I'm like, oh yeah, that sounds great. That sounds great. I'll put it in my cart. I'll come home and I'll be like, oh, it's not even made from a whole grain. It says it's from a whole grain on the front, but it's like 80% refined grain and 20% whole grain. You know what I mean? Like something like, it's like, I go and look and I'm like, how much?
I can't believe that's even allowed. I'm like shocked that they're even allowed to.
Of course it's allowed. It's the same thing with like free range chickens. Like, just because it says free range chicken just means that they had access 5 minutes out of the day to go outside. Like, oh my gosh, it's just full of lies. And that's another episode that we have to do with Dr. Nisha, is just dissecting labels. Because I have no freaking clue how to do that. Like, I would not know. And so we got to do it.
Yeah, it's taken me years of education to learn how to read a label. You know what would be actually amazing? I mean, we can absolutely do another episode, but it would be amazing to talk about nutrition labels, all of this on like an Instagram live and talk to people. And we can like even post it. We can take the audio and post it as an episode on Spotify and Apple. Yeah. But that would be amazing to actually get people involved too, because so many people, we've actually had questions about like, how do I read a nutrition label? So that would be amazing to just like talk about what even is a whole grain, how is that labeled, and just break down how many different types of sugars can there be, and even if it's sugar free. Let's look at like sucralose, everything that we can have in it. So that would be amazing to do.
Yeah, we can call it Jess Gets Her Mind Blown.
No, it's like my mom and my dad, for instance, are like, they're my prototypes. Like I test things out on them, and like they live in a different state, but whenever I visit them, we'll go grocery shopping, and invariably my mom always wants to go to the grocery store. I don't know what is up with moms and wanting to go to the grocery store with you. Like when I'm like, Mom, I'm visiting you. Like, why do you want to go to the grocery store? But my mom will bring something to me and be like, it's made of wheat. And I'm like, yes, Mom, wheat is, if it doesn't say whole wheat, it's refined. And like, she didn't understand that. And I don't expect her to, like, no one's ever told her that. And so now my parents, like, they know, like, oh, it says whole wheat or whole X, Y, and Z, because like that's what happened to me with the pasta recently. It said like quinoa pasta, and I'm like, oh, awesome, pasta made of quinoa. And then I'm like, oh no, it's like white flour. How did I miss that? And then some quinoa down the line. You know what I mean? Like, people don't know unless they look. And so, my parents, like, they've been in this country for like over 40 years, but it's still hard for them to read nutrition labels and understand, and I try to teach them, and it's working slowly. They're learning. And so, I like test things out on them, but they're really proud. They come home and my mom will be like, I got this whole wheat bread. And I'm like, great, Mom, it sounds good. Sounds awesome. Because they both have diabetes.
So cute. That's so wholesome.
That's so nice. Yeah. And they are both improving their diabetes. So
that's amazing.
It's so good. Yeah.
That is awesome. Wait, real quick sidebar before we wrap things up here. This is gonna be dumb. It's gonna be a dumb question. What does refined even mean?
Yes, no, that's not a dumb question. That is like a very important question. So you have a whole intact grain, and when you remove the outer part, which is the bran, which is considered the fiber-filled part, it has other components, and then also the germ, which is like the part where the healthy fats are. There's some B vitamins in there. You're left with the endosperm, which is like the starchy inner layer. There are some vitamins and minerals in there, but that's what it means. So when you make white flour, like you basically made white flour from like the endosperm, that's the leftover part. So you want to eat the whole intact grain so that you get all three parts, especially the fiber-filled part on the outer layer. And so it's really important. That's why I always tell people, like, I love carbs. I just try to eat whole grains as much as I can. And the Whole Grains Council has a fantastic website. Fantastic. You can learn how to cook whole grains on there. What's a whole grain? Gluten-free. There's gluten-free whole grains, especially for patients with celiac disease or non-celiac gluten sensitivity, if they're avoiding gluten for those reasons. It's so much information on there. Yeah.
Cool. I'm going to go check it out. It's Whole Grains website.
Wholegrainscouncil.org.
Wholegrainscouncil.org.
Yeah, they have that's the educational material that I carry in my pocket. So
nice. One of my favorite things that I learned about was Enriched Flowers, and I was learning about how they literally just strip so much from these different things that we eat and then literally have to enrich them with the vitamins again. So it's like they're taking it away and processing it and refining them, and then they have to enrich those things back into it. I was just like mind blown. So
I know, mind blown.
But is that a baking thing though? Because if you try to like bake a cake with a whole grain flour or something, it's going to be disgusting. So like, is that the reason?
Yeah, the grains are going to, the whole grains are going to change. The flour can change the texture of your, for instance, if you're using a recipe that's calling for white flour, like, if you use whole wheat flour, is that going to possibly change the texture? Yeah, it can. I, like, for instance, bake my banana bread with whole wheat flour, and it does, change the texture a little bit, but I don't mind it, right? Like Savannah was saying earlier, taste buds adapt, and my husband prefers it that way too. I mean, he's also like my other like prototype test bunny. Like, he's him and I have different dietary patterns, and he's more vocal about. He'll tell me like, I don't like this, or like, I gave him like a fruit bar the other day, and he was like, I don't like this, don't give it to me. And that's okay. That's okay. But I don't mind the texture changes. Like I was making a mug cake yesterday, and it was from a recipe that used white flour, and I was like, you know what? I'm going to put in some whole wheat flour, or sometimes I'll grind oats in my Vitamix and use oat flour. And it's an experiment. This is something that I just experiment in my own kitchen. Sometimes it's a flop and sometimes it's great. And if I find something that works and we both enjoy it, that's how I'm going to make it. Like pancakes. Like I got my pancake batter down now to the T, and that's how I make it. And it still makes pretty fluffy pancakes. Now, are they the fluffiest of fluffy pancakes ever?
Drop that recipe.
Yeah. Yeah.
I want it. I want to know.
It's pretty easy. It's good. And I think it still makes fluffy enough pancakes. But maybe somebody will disagree. And like I said, like I tell people, like, just because I like something like the way I like it and I share it, you may not like it that way. And that's okay. Let's try to figure out a way that you like it, or maybe you'll just never like it. And that's okay.
Yeah. Different. Every single person is different with what they like. I love to blend oats and make a flour out of it. And more often than not, what I'm experimenting with in my kitchen does flop, but eventually I get it right. So thank you so much. So we're going to have Dr. Nisha go ahead and announce the weekly challenge for this week.
Hey everyone. So I am challenging you all that in the morning when you're getting ready or when you're drinking your coffee or when you're drinking your green tea or whatever you drink, water, it doesn't matter. I want to challenge all of you to eat a half a piece of fruit. So if that's half an apple or half an orange or half a banana, that's what I want to challenge you all to do.
That's
so,
fantastic.
Yeah, get to it.
Yes, we love it. Creating habits, 1 cup of coffee at a time. So does that mean on my second cup of coffee of the morning, I have the other half of the fruit?
You could totally do that. Yes. And
I love that.
And it could just, yeah, totally. Why not?
And snap a picture of your morning coffee or routine and tag us on it. We want to see everybody's.
Yeah, I want to see everyone's fruit. Yeah.
Yes, absolutely. Well, Dr. Nisha, this has been the best hour. It has been so great and so educational. Thank you for your honesty and your advice. And we love hearing about your passion projects and how you back it up with research and science.
Thank you both so much for having me today. I had honestly the funnest time talking about all of this. It's near and dear to my heart, something I constantly think about in and out of the hospital. And can't stop, won't stop. Got to keep going. Got to get people healthy, right? Got to do it.
Yes, I love that. Thank you so much for being vulnerable and sharing so much about your personal journey as well. We so much appreciate that. So you can find Dr. Nisha on Instagram at Dr. Plantel. So it's DrPlantel, just like plant, Dr. Plantel. To find us and be a part of our family and community, join us on Instagram, TikTok, Twitter, Facebook, everywhere at And a Diet Soda. Keep an eye out. We really do want to have this Instagram live, teach everybody about how to read food and nutrition labels. So keep an eye out for that. Thank you again, Dr. Plantel. Dr. We will see you all next week. Thanks for listening. We hope you were able to give yourself a little love today. You deserve it.
Be sure to subscribe to this podcast and check us out on social media for weekly conversations and attainable challenges for your health.